Losing a toenail can be an unnerving experience, but don't panic. It's important to know how to respond when you find yourself in this predicament. Proper care can prevent infection, promote healing, and guarantee the new nail grows back healthy. My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Losing a toenail is often caused by injuries, fungal infections, and even certain medications. In today's video, I'll discuss losing a toenail, its common causes, and essential steps to handle this issue. Before I do, I wrote a book all about toenail health. I'm happy to send you a copy as a gift. Just visit www.mytoenailbook.com to request it. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. While it may be alarming to lose a toenail, it's a relatively common issue that often results from physical trauma or underlying health conditions. It generally isn't typically a cause for immediate concern, but it's essential to understand what's happening. Your toenails are made of a protein called keratin, growing from the base of the nail under your skin. When healthy, your nails should be smooth, consistent in color, and have a certain degree of hardness. However, if you notice that a toenail is loosening or has fallen off, it's likely due to an adverse event affecting the nail bed or matrix, where the nail growth originates. Toenail loss can be temporary or permanent, depending on the severity of the damage. Temporary loss usually involves the nail growing back over several months, whereas permanent loss can occur if the nail's matrix is severely damaged or destroyed. Despite the distress it might cause, toenail loss is often treatable and preventable. The key is to promptly identify the reason for the loss and treat it appropriately. You also want to take steps to prevent future occurrences. In many cases, a direct hit or repetitive injury to your toenail can cause it to fall off, a condition often seen in athletes and runners. These physical traumas can lead to a condition known as runner's toe, in which blood accumulates under the nail, causing it to become discolored and potentially fall off. Moreover, dropping a heavy object on your foot or stubbing your toe can cause sudden, severe damage to the nail bed. This can lead to your nail loosening over time and eventually dropping off. If you're frequently wearing tight shoes or high heels, you're also putting your toenails at risk. The constant pressure can cause damage to the nail and nail bed, leading to the loss of the nail. Despite the discomfort and visual displeasure, it's important to bear in mind that nail loss due to trauma is usually temporary. Your toenail will typically grow back over several months. However, if the nail bed is severely damaged, it can interfere with nail regrowth or cause the new nail to grow back deformed. Hence, protecting your feet and toes from injury is crucial to prevent such issues. Beyond physical trauma, fungal infections often stand as a common cause for toenail loss. You're most likely to encounter this problem if you frequently expose your feet to warm, damp environments where fungi thrive. Athlete's foot, known medically as tinea pedis, is one familiar fungal infection that can spread to the toenails, causing them to become discolored, thicken, and brittle before they may eventually fall off. Another common culprit is onychomycosis. This particular fungus specifically targets the nail and nail bed, causing similar symptoms. These fungal infections often begin unnoticed with minor symptoms such as small white or yellowish spots beneath the tip of your toenail. As the fungus spreads deeper, it can cause your nail to discolor, thicken, and crumble at the edge. If you suspect a fungal infection, it's essential to seek out prompt attention from your podiatrist. Over-the-counter antifungal creams and ointments can be effective in the early stages, but more severe infections may require prescription medication. In some cases, removal of the affected nail might be necessary. While fungal infections can certainly lead to toenail loss, another common cause to be aware of is the repeated pressure or friction that your toes endure, especially during vigorous activities like running or hiking. Runners, hikers, and others who engage in high-impact sports are often more susceptible to this issue. This is because the constant barrage of pressure on your toenails can cause them to separate from the nail bed, leading to a condition known as onycholysis. Repeated pressure or friction against your toenail can cause it to thicken and eventually fall off. This effect is compounded if your shoes don't fit properly. Shoes that are too tight, too loose, or don't provide adequate support can cause excessive friction on your toenails. This is why it's essential to invest in properly fitting footwear, especially if you're involved in activities that put a lot of strain on your feet. You want to ensure that you have the width of your index finger between your longest toe and the end of the shoe. Not just physical trauma, systemic health issues can also lead to toenail loss, underscoring the importance to keep an eye on your overall health. Conditions such as diabetes, peripheral arterial disease, and fungal infections can cause your toenails to become brittle and fall off. These diseases affect your blood circulation, which in turn affects your nail growth. Diabetes, for instance, can lead to poor blood flow to your extremities, resulting in slow nail growth and increased vulnerability to infections. Peripheral arterial disease, on the other hand, narrows your arteries, reducing blood flow to your limbs and potentially causing your nails to fall off. Fungal infections, particularly onychomycosis, can also cause toenail loss. This condition starts as a small white or yellow spot under the tip of your toenail, which then spreads, causing your nail to discolor, thicken, and crumble at the edge. Lastly, skin conditions like psoriasis can also lead to toenail loss. Psoriasis causes cells to build up rapidly on the surface of the skin, affecting the health and growth of your nails. What do you need to do after your toenail falls off? That depends on the situation. The nail bed, the skin beneath the toenail, is comprised of specialized cells that soften or harden depending on if the toenail is attached. If the nail has already loosened, such as due to injury, a new nail may be present when the nail falls off. In these cases, the nail will come off without pain or bleeding and requires no specific care. When the nail comes off more traumatically, there will be pain and bleeding. In these cases, you should come to visit your podiatrist to care for the toe safely and correctly. Contrary to popular belief, there's a myriad of misconceptions surrounding the loss of a toenail that needs to be accurately debunked. You may have heard that toenail loss is a natural part of aging, or it's solely due to fungal infections. These are common myths, and they're not entirely true. To start with, toenail loss is not a natural part of aging. When your nails may get thicker and brittle as you age, this doesn't necessarily equate to toenail loss. It's important to differentiate between normal age-related changes and symptoms of an underlying condition. Additionally, while fungal infections are a common cause, they're not the only reason for toenail loss. Trauma, injury, or certain systemic diseases can also lead to this condition. You may also believe that all toenail losses are painful. Another misconception. Although some may experience discomfort, many people don't feel pain when their toenail falls off. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Be sure to order my free book all about toenail health. You can request your free copy at www.mytoenailbook.com. Losing a toenail can be alarming, but understanding the causes and taking the right steps can help manage it effectively. Remember, immediate care and long-term prevention are key. If you're uncertain or if complications arise, don't hesitate to contact our office. Your toenail health is important and deserves your attention. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.